So we will be doing the success story of Dr. Nag Sanjeev. So about Dr. Nag is he is here, okay, in the IMG from the very beginning, okay. Even when I didn't start any course, I was just taking the free mock sessions and all that stuff. I didn't write the books and everything. He was there. So that means he was there from the very beginning of this IMG. When we were like a people of 30 or 40, he was there. Okay. And it was a long journey. I get to know him maybe from last November or something like that, right? And now it's October, almost October. So it's been a year. He's been a very nice person, a good friend. Okay, and he passed with the flying colors, with the high marks, and I assumed he's going to have this mark, and he had that. And now, Dr. Sanjeev, it's all yours. Go ahead.
Yeah, thank you, Dr. Atik, for the fine introduction. Like, this was a routine for me, logging on to the Zoom session link shared by Dr. Atik for the past, 7 to 8 months is a routine. So I miss those sessions very much. It's been a long time since I have been speaking to Dr. Atik and the IMG candidates as well. So I'm so happy that I'm back, at least for a while. So, Dr. Ramu and Dr. Paresh, they have very well explained like how you have to prepare and how the success story, how their experience was. And also, I don't have anything extra to add like to what they have explained. And moreover, I have explained everything like my experiences, how I prepared and all. I scribble once in a while in our group as well. So I just want to highlight something on our IMG course as such and the MRCS exam as such. Moreover, my success story is a bit outdated because after my success, 3 or 4 sessions have already been conducted. So a lot of IMG
Yeah.
candidates have shared their success as well. So I am a bit late sharing my success. So there is no point in explaining those things. It will be boring as well. So first of all, regarding this MRCS exam, it's like a very straightforward exam. You don't have anything to worry about this exam. Like if you have done your part well, you will definitely clear because this is not a rank based exam. Only the first 5 candidates are going to get. There is nothing like that. If you have a cutoff mark, you will clear. So if you have put your effort, if you have done your part well, definitely you are going to cross the line. So that is the first achievable or attractive thing about this exam. And second one is that this exam has in all aspects it has all international standards. The examiners are well balanced. The exam as a whole is a well balanced one. The examiners are well behaved, and there is an overall supervisor to check the exam process, our anxiety part, and the examiner's attitude. Everything is being monitored thoroughly. And they at the end of the exam they ask for our feedback also because in my exam I did in July Delhi 23 session, and there was a station, the phone, the consultant station. The consultant was he was speaking in pure Irish slang. None of the candidates were able to follow his slang. Like when I took my session personally, he was asking me question, but I was thinking like he was scolding me for giving a wrong answer. So for some time I kept completely silent. Like I didn't even comprehend that he was asking me a question. So I kept completely silent. Then she shouted me that why are you not answering my questions. So we were not totally stuck with the slang. So I thought it was my personal issue. But after the exam, we were sitting in a room. All the 10 candidates were there, and everyone were explaining about this station that they were not able to understand the slang of the examiner. And there is a supervisor for the exam. At the end of the session, he or she comes to us and asks if we have any personal suggestions about the exam or if there is anything we have to explain about the examiner. At that time, none of the the examiners or the conductors of the exam, the MS people know RCS representatives will be there. She is a representative of all the 4 colleges of RCS. So we told her that we have a personal issue with this particular station that we were not able to follow the slang of the examiner, and I think that it was taken into account because it was not at all reflected in my skills marks as well. I got a pretty good mark in skill station, so that is a beauty of this exam. If you have any personal issue, if you have an issue and that is in common, it will be rectified, it will be solved. And the exam, as I told earlier, it's a very straightforward exam. If you study your part, you will definitely clear it. And next is what to study. What to study and how to study. It's very well and perfectly explained by Dr. Atik and his IMG course. Like Atik bhai told that I cleared my party in September 2022, and I was not willing to fly off my country to for Part B. So I waited for the next session in India, and I had nearly 9 to 10 months gap for my Part B. So a few of my friends who were from Bishoy Sir's party group, we were just discussing with Salah notes, PDF note on Part B. We didn't know how to prepare for Part B. We were just reading through the notes, and it was Esra. Esra is one of mentor for Dr. Atik's party course. She was the one who guided me to Dr. Atik, and I'm very thankful to her for that. Like when I joined Atik's IMG group, it was not a group of 30 or 40. Dr. Atik, I want to correct you that I was a ninth member to add on to your group.
Yes,
When I
yes, yes.
joined, there were only eight members before me to join, and
Yes,
there were one is Atik, Dr. Atik himself, the other were Dr. Strange, the Tanvir, and Isra, and others. So I was,
yes.
I mean, it was just like a study group that time. It was not at all like a course, or it was not at all like a discussion. And it was just a study group. We were discussing something going to happen, like what we wish to speak, we will speak up. There were no guidelines, there were no timer, there were no questions to be asked. It was just like a discussing. I mean, on my very first day, I was given the station of the cancer laparoscopy. I don't know even what part B is. I don't even what the station is. I didn't even know that there was two stations like knowledge and skills that time. He asked me like, yeah, I'm the doctor. Just imagine that one of my patients' arthroscopy station, I mean, arthroscopy case was cancer. How will you explain? I explained it for nearly 30 to 40 minutes, if I remember. I was
Dr.
keep on
Sanjeev,
explaining about.
one second, please. Your
Uh,
voice is not clear. Like there is something in your mic or something like that. Can you just do something about that?
okay, is it clear now?
A little bit, yes.
Okay. I think I was falling out of range. Okay.
Yes. Yes, go ahead,
Okay.
please.
Yeah, that time IMG was just I mean, a friendly chat group. It was just like a friendly chat. I'm so happy that from that friendly chat group, it has stupendously risen to a great group. I mean, it is one of the, I mean, keeping my hands on my heart, I can say that it is one of the best group and the best ground available for your Part B preparation. There is no doubt in that. Because Dr. Atik is such a brilliant mentor. He knows each of his candidates so personally that just like Dr. Atik, after my exam, I just explained to him how my stations were, how I performed. And you can't believe that he predicted my marks to the core. I mean, the mark was just within a range of 3 marks from it, from what he predicted for me. So that is the level of understanding that he has about his candidates. So just stick on with his notes, just stick on with his course. If you have not joined, join first. And if you have joined, then stick on with his notes, participate in his notes. Yeah, that's one other thing I want to say. That if you keep on actively participating in the notes, your exam is just going to be another move.
Dr.
You won't
Sanjeev,
even, you won't
Dr.
even,
Sanjeev, we are not able to hear your voice. Is it for me or everyone?
how
Hello?
is it now?
Yes, it
No,
is
no.
tracking.
How is it now?
No,
Can you
no.
try any other mic or like any headphone or
Okay,
without the
one second, one
headphone?
second.
I think you have kept your phone in charging.
second.
It does sometimes.
Is it good now?
Yeah, it's good.
Excellent. Excellent.
Okay, fine. Okay. So,
Yes.
yeah, what I was telling, yeah, if you actively participate in the mocks, the exam is just going to be another piece of cake for you. Because I was very active in the mocks. I used to participate, even if I miss some session on the class, I won't miss a mock. And the mocks were the great, I mean, grounds for practicing as well. So if you keep on, I mean, participate in his mocks and keep on, you have to attempt at least, try to attend at least one station per day for Dr. Atik's mocks. Like, I remember that in his first course, I was a candidate of his first course, and during his first course, we just were just of 7 or 8 people were attending his mocks, and I mean, everybody will get one station, and after attending one station, there will be a call by Dr. Is there anybody willing to attend the next question, like that? Because after one session, we will just quit the session if
Yes,
you go on
yes, 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 yes.
but during the second course, it completely changed. For 10 questions, there were 20 to 30 participants. Like, we were not able to get at least one station completely. It was split into two or three candidates. We had to share among us for one station.
Yes,
So that was the growth.
for only 5 stations, there was like maybe 20 or 25 candidates raising their hand.
Yeah,
I was saying
that
like,
is
what I'm going to
within a
do?
within a span of one course, his course has become so popular because that is the main part, his active participation, the interaction, the discussion, and the live sessions. Those are the attractions and those are the must needs for an MRCS Part B preparation as well. Because reading from the books and simply keeping in your mind, and you know all the steps, but if you are not able to express it, what is the point? Even if you don't know the exact answer, but if you are able to make the examiner have a feel that you know the answer, then you are a winner. There's a lot of difference between knowing the answer and explaining the answer. You don't have to be thoroughly well versed to explain an answer. You just need only a basic knowledge, and that you will get if you take part in the mocks only. If Dr. Atik prompts us to keep on answering until he will make us answer to every question. That is a participation Dr. Atik has among his candidates. So if try to attend the mocks, try to he has a big heart. He's conducting the mocks free of course for other not for his course candidates, but for everyone he's conducting. So at least make use of that. If you keep on practicing in the mocks, the exam is going to be just a simple one. So you don't have to worry. I don't want to explain my success story because it is pointless, because everybody have their own style of reading, their own style of learning. But wholeheartedly I will say that you need at least 3 to 3.5 months of preparation. I won't say that Dr. Ramu, he did within 49 days. He himself said that this is not a classical method. I also will say that don't think that if Dr. Ramu could get MRCS with 49 days, then you can get. No, there is nothing like that. To be on the safe side, you need at least 3 to 3.5 months of preparation. That's what I say. And you have to be well thorough with the notes. You have to go through them at least 5 times. I went through the notes 5 times. So that is my advice to the candidates also. You have to go through the notes at least 4 to 5 times. You have to be thorough. Anything asked from the notes, you must answer it. Outside from the notes, you can skip. You need to answer only 70% of the question. You don't want to answer 100% of the question to pass the exam. You need only 70% to clear the exam. So you don't have to worry about the questions you left unanswered. But any question asked from the notes, you have to answer. Then you can easily pass. Forget about the questions outside the notes. You don't want. You don't need that to get an MRCS. You need only what stuff is given in the notes to get the degree. So just be thorough with the notes and forget about the anatomy images. I would say that don't rush behind too many atlases. Just stick on with one atlas, or just stick on with Dr. Atik's notes. Just fix the orientation of each and every organ or anatomy of every part inside the body. Like, you may be knowing which all ligaments are there in the foot tarsal bones. But if you are given a tarsal bone and asked to point out where this particular ligament is attached, you may be worried. So you have to be, don't just by heart the images. You should have a pakka orientation about these images and these structures. Then it is done. Anatomy, over the last few sessions, it is getting more and more tougher. And as Dr. Parish said, it may be because of the prevalence of the courses. A lot of courses are coming up. Students are much more prepared for appearing for the exam. So quite naturally, there will be a tendency to make the exam more and more difficult. So anatomy is one thing I think they have attempted first, maybe. In the coming years, you can expect the pathology and critical care also to become more difficult. So just forget the subject, the difficulty and all. Whatever you learn, you just try to fix it into your heart. Don't just memorize them. You just take the concept into your heart and into your mind and just revise it more and more. And for practicing clinical sessions, I would say that you should have a dedicated partner. I did all clinical examinations at least thrice on my wife. My wife is a doctor, so there was no issue doing examinations on her. She was very cooperative as well. So try to find a partner for your skills examination practice. And there will be a strong point for you. Every candidate will have a strong point. You will be either strong in anatomy, you will either strong in critical, or will be either strong in communication. So focus on your stronger part, try to improvise that. Focus on your weaker part, practice more on that. It is, I will say that with proper reading and regular practice, this exam is nothing but a simple, like maybe an annual exam in your school, just like that. It's not at all a tough exam, but we have to focus on the method of preparation. It's quite different from the exams which we have come across maybe in our career. It's just a different approach is needed. But the material, the knowledge, it's just what we have gathered during our undergraduates. It's just above the graduation level. It's not a post-graduation exam. Whatever topics are being asked, just above the MBBS level. Not the MBBS level, maybe just above the MBBS level. So with your basic knowledge and some practice, you can easily crack this exam. That's the only thing I have to explain to the upcoming candidates. So I wish all the candidates who have passed very hearty congratulations to you, and the upcoming candidates very best wishes to you. And yeah, so that's all I have to explain. If you have any questions, you can ask me.
Everyone, please thank Dr. Sanjeev because he was the person who said me, Dr. Atik, I cannot study from online anything. Okay, can you just make one like printed books for us? Okay, and he was the person was pushing me when I'm going to have my books, when I'm going to have my books. Okay, he was pushing me. Okay, are you done with your books? Are you done with your books? Always. Okay, and I was rushing out of time and all that stuff, and then finally our IMG notes has like formed into a books which you are having right now in your hands, or like you will be having that. So thank this person about that. Okay, he was the person who like first said like we need a book, like a hard copy. Okay, thank you so much for that, Dr. Sanjeev.
Thank you, thank you. And
All right.
for the others also, Dr. Atik has actually asked me to, take part in the, making this book as well. But due to my schedule, I couldn't be a part of this book. Had I been a part of this book, then I would have been world famous by now because my name would also been come in that book. But I missed that opportunity. He asked me to
Yeah.
prepare the history taking for ortho stations. I am an orthopedician, so he asked me to prepare the history taking, but I couldn't do that at that time. And honestly speaking, I never thought that IMG is going to be this much success at that time. Dr. Atik, I'm very thankful to you, and I'm really happy that I met you and I was your course candidate. I never repent. Choosing your course, so I'm so happy with that. And thank you, Dr. Atik.
Thank you so much, Dr. Sanjeev, for sharing your honest opinions and all that stuff. Okay, at this point, we are going to take few questions. If you want to ask any question to Dr. Sanjeev, you're most welcome. Please go ahead. If there's any queries or anything, what happened, Dr. Sanjeev, is I think the candidates are becoming more smarter and smarter. Remember, during our last maybe 1 month, 2 months before when we are having the success story, there are lots of questions. But now the candidates are becoming so smart.
They don't want to lose their
Yeah.
time asking questions. They want to invest their
Yes.
time too in reading. That's why.
Yes. Very nice. All right. So, anyone wants to ask any question? Nothing. Okay. All right. So thank you, Dr. Sanjeev. I think you were rushing and you have made it to share your experience because in the last session you missed that. And it was very important to have your success story because you were with me from the very beginning, right? So, and I will hope like you'll be there in the group as a IMG family,
Definitely,
as a
definitely.
mentor
I
for
will be in the group
others.
until you throw me out.
No, no, no. You are the pillar, you are one of the pillars there. All right. Thank you, brother.
Thank you,
And
miss.
I hope to see you soon.
Yeah, definitely.
All right.
I'm waiting for that
Okay.
meeting.
All right. Okay. Okay. Thank you, Dr. Sanjeev.